Good morning, everyone. Welcome to this session on human-centered design, including demand creation. We have like 1 hour, 15 minutes and 4 speakers. So what I will do is give 10 minutes to each speaker. I hope that's fine with you. Maximum 12 minutes. Because we would like to have some question and answer session, and I believe there will be questions even from people who are watching this session, so we may have to take a few questions from there. So let's give ourselves some time for questions. So as you know, this is a session on, I'll introduce the panel, but let me introduce the topic. This is a session on human-centered design. And as you know, civil registration is all about human beings. It touches every person at least twice in his or her lifetime. And where you have marriage registration, it would touch thrice. And if there are divorces, then you go to the registrar 4 times, basically. So it touches human lives from the cradle to the grave. And it's basic to proving person's existence. It's also about realization of human rights. So it's all about humans. A right to be registered at birth, right to a legal identity, even right to survival, which is a human right, a large part of it comes from the civil registration systems. So therefore, it's imperative, and I think it is important that government should design CR systems that are human-centric. In developing countries, and in developed countries, most of the systems that you see in the CR systems are passive systems because people are aware, they have the knowledge that they have to come to the registrar once an event takes place, and therefore you can afford to have a passive system. But in a developing country, you cannot afford to have a passive system, in the sense that you may have your infrastructure, your registrar sitting with a register, people have to come in and report because the responsibility of the reporting are with the parents. So in that situation, you cannot have a registration system which is passive. You have to be more proactive. Because in a system where there is not much knowledge, not much infrastructure, it is important that in terms of realization of the rights, it is the responsibility of the government as a duty bearer to make sure that every event is registered and every birth and death event are registered. So you can't just say that the law talks about parents' responsibility is not enough. I think governments have to play a very important role. And when you talk about human-centric design, there are 2 sides to it, the supply side and the demand side. Now, supply side, we have been discussing the supply side a lot. It's about creating improved service delivery. Supply side would mean creating infrastructure, improving quality of service, having the right laws and procedures that are aligned to the social and cultural norms of the country. Sometimes you may have a law, because this we have seen in African context, that you have the colonial laws which were like made small incremental changes, and they were actually not for the native people, they were for the colonizers. So you need to look at the law based on what is the social norm in the country and how events around birth and death have, cultural and social norms are built around it. And therefore the law has to align to that in order to make sure that they improve. Then you have to take the care of the people living in the margins of the society. And therefore you have to have a design that addresses that. For example, you need to reach out to the refugees. You have to reach out to the children who are born in the streets. So you have to make arrangements for that. So that is important in terms of provider. And when you say human-centered, it doesn't mean that you cannot use technology. I mean, it's not about manual thing. It's also about technology, because we have to harness technology to make human-centered design. Technology doesn't mean that we have taken away human from there. This is technology which serves human beings, reaching out to the marginalized and reaching out to the person at the last mile. Technology can provide a lot of support. In a developing world, it's very hard to create demand. Sometimes we say birth certificates are so important for having a passport, sending children to school, providing ration cards. But once you start saying that you are creating demand by making things compulsory for production of birth certificate, actually you're infringing on the other rights, right to education. So if you say you won't be admitted to school unless you have unless you have a birth certificate, it's an infringement on right to education. So you cannot make things compulsory. It has to be persuasive in nature. But these things have to be taken care of. And in addition to creating awareness among the general public, which is again a important provision that needs to be made, it is also important to ensure that we don't create conditions that don't strangulate demands. The problem is we are strangulating demand because we are charging for certificates. We are creating infrastructures where people have to travel 50 kilometers to come and register. Then you charge for certificates. So I think if you have to create demand, you have to issue certificates so that more demand is created, more awareness is created. So I don't know. I mean, we should be hearing from the panel. They must be having some solutions about how to create demands, because this session is also about creating demands. So I'll stop here, because if I don't want to preempt what is coming. So we have an excellent panel, and fortunately I had the privilege of working with each one of them at some point of time or other. But I think we will move. The order will be like this. It would be Tanzania, Bhaskar Mishra, who would go first. I'll introduce Bhaskar. Then we have Gloria Mathenge, who will be coming next from the Pacific, and followed by Mukut from Bangladesh, and then finally Vibeke from Statistics Norway. So let me first introduce Bhaskar. Bhaskar actually works as a child protection officer specialist with UNICEF Tanzania and is based in Dar es Salaam. He works in close coordination with government of Tanzania in implementing the new decentralized birth registration system, and is the technical lead from the UNICEF side. In addition to working with UNICEF between 2012 to 2016, Bhaskar worked for the government of India. He was the Deputy Registrar General for Civil Registration and Vital Statistics in government of India, and he also supervised and conducted demographic surveys such as sample registration and annual health survey. So I would now, without much ado, ask Bhaskar to make his presentation. So it's like 11:25. So 10 minutes to you, Bhaskar. 10 to 12 minutes, let's say.
Thank you very much. Good morning to all of you. This presentation will tell you what the government of Tanzania and UNICEF have done to improve the birth registration situation in Tanzania mainland. How does it go?
No. Up and down. Is it on?
Yeah.
Sorry, this one. Press it.
A human-centered design in the context of civil registration and vital statistics entails solution to problems by involving the human perspective at all stages of civil registration. And these stages are notification, declaration, registration, and certification. The ultimate goal, of course, remains universal coverage of birth and death registration. Let us look at the drivers of a human-centered CRVS process. I will start with distance. The importance of registration points being closer to the community hardly needs any emphasis. Physical distance not only affects the pace of registration and certification, but also compounds other challenges. Some of the factors that govern the choice are type of terrain, nature of settlement, quality of public transport, coverage in terms of area and population, and consideration for remote and difficult to reach population. Costs should be affordable to all. Affordability is a function of direct cost and indirect costs. The direct costs include fee for registration and certification, and indirect costs include travel costs, loss of ways, etc. Notification is an alert about the occurrence of an event to the system. What we need for notification is data on few fields to uniquely identify an event. This can be done as part of the civil registration process or through some other systems. Notification should be simple and should not be confused with registration. Registration and certification. Registration gets completed when all the details in the prescribed registers are filled in, verified by the applicant and the registrar, and signed by both. As you know, a certificate is nothing but an extract out from the same register. So registration and certification has to be seen like a Siamese twin and should go hand in hand. Having a clear, comprehensive, and forward-looking law is one of the statutory requirements. Birth and death certificate have evidentiary value in the courts, and the law should reflect the CR business process. It should not be otherwise. Awareness holds the key to demand creation, and demand creation is needed on 3 counts. Awareness is needed on 3 counts. To create awareness about the importance of birth and death registration, awareness about the CR process, when and where and how to register, awareness also about utility of birth certificates. Interoperability with other systems benefits all and the community the most. In particular, integration with 3 systems are critically important, with the health system for registering newborns and clearing the backlog for children aged 1 to 4, with the education system for clearing the backlog for children aged 5 to 17, and with national identity system for 18 plus. Quality vital statistics leads to evidence-based planning. This in turn improves the quality of intervention in the community. And CRVS, as you know, is the only source which yields data at all administrative level almost on real time. Let us review the existing Tanzanian system through these drivers. Registration is centralized and is done at district headquarters, which is anything between 80 to 140 kilometers. Terrain is difficult and mountainous with a weak public transport system. Tanzanian CR process is one of the costliest systems. Parents have to pay Tanzanian shilling 3,500 for registering birth of a baby within the normal reporting period of 90 days. 3,500 shilling is equivalent to $1.6. 10,000 shillings from 90 days to 10 years, and 10,000 shillings for 10 years onwards. A registration process requires at least 2 visits to district headquarters, and generally 1 visit will consume 1 full day. So if you add the direct cost and the indirect cost, the CR process becomes a prohibitively expensive exercise. Notification is cumbersome, too detailed, and involves parents. Nurses at the health facility notify for institutional births, and the village executive officer in case of domiciliary births. Unfortunately, most of the village executive officers are not even aware about this responsibility. Health facilities also function at different levels of efficiency. Post-registration, the responsibility for registration rests with the parents. Consequently, less than 25% of births get notified. Registration and certification is a 2-step, 2-visit process. Parents carry the notification slip and visit the district registrar for registration. District registrar for notification, it has gone. And they're asked to come back after 2 weeks to collect the certificate. Next. The legal framework goes back to 1970. The existing Birth and Death Registration Act came into effect in 1921. It has been amended 9 times since then, but without addressing the core issues of distance and cost. Until 2009, registration was not compulsory for the natives. There is limited knowledge about the importance of birth and death registration across the board. Correct knowledge about the CR process is a big concern, especially in rural areas. The systems in Tanzania are at different stages of evolution. There are challenges of coverage, standards, too many unique identifiers, and integration across the system. Centralized nature of CRVS system hinders effective integration with other systems. No vital statistics is generated from the CRVS system due to poor coverage. As a result, less than 13% of under 5 children have a birth certificate. Another 11% only have a notification. Thus, more than 75% children are outside the purview of CRVS system. There are huge differentials by residence and wealth quintiles. Consequently, unregistered under 5 children in Tanzania account for 16.4% in Eastern and Southern Africa, 8.3% in Sub-Saharan Africa, and 4.1% across the world. Concerning newborns, only 637 gets registered out of 5,542 born every day. Let us look at Tanzania through some basic statistics. This will help us in understanding the Tanzanian context better. Africa as a continent will double its population by 2050. Tanzania by that time will increase its population by 2.4 times. From its current position of 24, it will go to 14th position. And even in 2050, Tanzania will have a TFR of 3.5 and will be the 4th largest contributor to population. What I want to emphasize is that this will create a lot of challenge for all systems, including the CRVS. So now is the time to act. Next. New birth registration system. The Registration, Insolvency and Trusteeship Agency, which is the central agency responsible for birth and death registration in Tanzania mainland, with the support of UNICEF, came up with a strategy on how to address the issues of distance and cost and to make registration and certification one-step, one-visit process in November 2010. A costed operational plan was prepared in 2011, and with the approval of interministerial working group, the new system was piloted in Temeke district in Dar es Salaam in 2012. The first launch took place in Beira region in 2013. Now the current system is in operation in 9 regions covering 58 district council, which is about 38 to 39% of Tanzania mainland. This year we're going to add 4 more regions that will cover half of Tanzania mainland. The existing regions are in light blue and the upcoming regions are in deep blue. The 5 pillars of the new system are decentralization, fee waiver, one-step, one-visit registration and certification process, innovation and public-private partnership. Health facilities and ward offices have been declared as registration point. Fee for registration and certification has been waived by the government for children below 5 years of age. Fine for late and delayed registration has also been waived for the same cohort. Registration and certification is done in one go, and immediately after registration, the first copy of certificate is issued. Data is captured in the field using mobile phones, and it's transferred to a central server at RITA headquarters. There is an online dashboard to reflect the progress. Last year, we added an online data validation module to compare the content in the scanned images vis-a-vis the uploaded data. The funding for this project is coming from the Government of Canada. And Tigo, one of the mobile service providers, as part of CSR, they provide mobile phones, SIM cards, routers, SMS, and internet services. They also help in contributing awareness creation. What does the new system bring about? In the 9 regions, there are 3,000 plus registration points against 41 district headquarters in the previous system. The registration system now is managed by 5,500 plus registration officers against 41 district registrars. The average distance has come down to 6 kilometers from 80 to 140 kilometers. Fee and fine are waived. The total waiver from the government so far has been to the tune of USD 3.6 million. So the total savings to the families on account of not visiting district headquarters 2 times is about USD 18 million. Next. The formal notification process was done away with. Instead, mother and child health cards are used as proof of birth. They contain all relevant information to uniquely identify a birth. In Tanzania, more than 98% of mothers have these cards. For others, they need to come with a recommendation letter from the village executive officer. Registration and certification happen simultaneously at the nearest health facility or the ward's executive officer. There is a tripartite MOU among 3 key ministries to govern the new process. The ministries are Ministry of Constitutional and Legal Affairs, where RITA sits, the Ministry of Health, and the ministry in charge of local government. The features from the MOU and learnings from the new system have fed into the national CRVS strategy and the legal review work. Awareness is done.
3 minutes.
Yeah. Awareness is done through a well-chalked out strategy. It uses a mix of modern and traditional methods. Declaring health facility as registration point marks a good beginning for integration with the health system. In the long run, this will prove to be a game changer for both the systems. Availability of real-time registration data is an important input for the upcoming ID ecosystem in Tanzania. The dashboard shows progress at the regional, district, ward, and health facility levels. It also generates disaggregated numbers by age, sex, place of birth, place of registration, and other variables. Data validation module makes data error-free and is ready to be shared with other systems. This shows the progress over a period of 4.5 years. In 2017, more than 1.1 million children were registered. This shows the certification rates in the 9 regions. The new system have helped in improving the overall certification rate from 10.5% in 2012 to 80.4% in 2018. This has also helped in improving the certification rate for Tanzania mainland to 28% from 12.9% in 2012. This is how birth registration data is captured. The application is Android-based. Data fields are coded and has inbuilt data range and consistency checks. The data is transferred through SMS to a SMS gateway. From there, it goes to a server and then reflected in the dashboard. This is how the home screen of the dashboard looks like. It has features to navigate down to health facilities and ward offices. This is accessed extensively by everyone, starting from the registration assistant to the regional commissioners. We use these numbers for computing percentages and share with everyone using WhatsApp and emails. The 3 windows show the data validation, different stages of data validation work. The first window shows that records are ready for validation, which means that images have been scanned, uploaded into the system, and form numbers are matched. The second window shows the actual data validation process. On the left side is a scanned image. On the right side is the soft data. There is a scroll to move up and down. Every data field has a default blank value, which is set right to OK status after validation. The system maintains a trail of all changes and generates a report showing how many characters were edited, added, or deleted. The last window shows that records are ready. That means they are error-free and ready to be shared with other agencies. Before I conclude, I will reiterate these 5 pillars and thank and acknowledge the partners, the Government of Canada for their generous support, RITA and the Government of Tanzania for leading the process, and Tigo for providing support on mobile phone and other services. Let me end by thanking this father from Geita region for being part of this initiative and wishing good luck to this little boy for a bright identity-enabled future. Thank you very much.
Thank you, Bhaskar, and you were really, the whole system, the way it is developed is so human-centered, and as I was saying a little while ago, that how technology can even make human-centered design. And particularly I was impressed by your presentation in terms of listing out the drivers of human-centered design and then reviewing the Tanzanian system against those drivers that you mentioned about. I still remember in Tanzania when I went there used to be a huge queue in front of the Tanzania Central Registration Office for obtaining certificates, long certificates. There was the short certificate and the long certificate, but that's all done away with. And I think it's very impressive progress which has been made. Thank you, Bhaskar. So now let's move to Gloria. Now, Gloria Mathenge is a social statistic. She works for the Pacific community. She has a qualification in demography and public health. She provides technical assistance and advice to Government of Pacific in the development of CRVS system and in analysis of administrative data generated by civil registration and health information system. She is the lead coordinator of the Brisbane Accord Group. Gloria worked with me in UNICEF, and she provided technical assistance to African government in the development of CR system. She is a co-author in the Africa CRVS assessment tool and guidelines and various other vital statistics guidelines. So with this introduction, may I request Gloria to make her presentation again, 12 minutes. You can with grace period of 2 more minutes.
All right. Thank you, Raj. I'll just quickly add that I'm making this presentation on behalf of the Brisbane Accord Group. And this is a group of partners that supports the development of civil registration systems in the Pacific. So when you talk about human-centric designs, I understand it to be designing systems that are about people, where people live, how they behave, and the events that surround their lives. How do I scroll?
She will do it for you.
All right, great. So in my presentation, I'll quickly run through why do we need to talk about human-centered designs and what do we understand this to be, and then contextual factors that influence the design of systems, innovating to increase demand, and I'll also touch on human behavior and how this, in one way or another, will touch on the design of systems. Next, thank you. So when you talk about human-centered designs, it is about taking a customer-centric view in how we design systems and how we deliver civil registration services to the public. It is about providing ease and convenience in civil registration and also recognizing that registration is not a primary need of the people to whom these events occur. When a mother gives birth to a baby, the first thing that gets into her mind is not getting a certificate of birth. When a family loses someone, getting a death certificate is not the first primary need of this. So it is important for us to recognize that registration is a service that facilitates the realization of other services from a public's perspective. And so ideally, it will be good to entrench registration as a component of other services. So why do we need to talk about human-centered designs? We on different occasions talk about birth registration being a human right, and in essence, civil registration is a human right. Every individual, every member of the population is entitled to this right by the government, and so in essence, it is the responsibility of the government to ensure that these rights are delivered to the people. So unfortunately, in most of our countries, the burden of registration rests with the public, and we ask them to pay for registration services. We ask the public to look for us meaning the government, and really the burden of all this process in most countries is designed to rest with the public. Next, please. So when we talk about human-centered designs, I think, like I spoke about in my first slide, it is about designing systems that are about the people in the place that in a particular place. So we have to understand who these people are. We have to understand their characteristics. We have to understand the environment in which they live in and their behavior. So demographic, social, economic characteristics of the population and environmental factors come into play very strongly on how we design systems. In the case of the South Pacific, where I work, in terms of the demographics of the population, we cannot ignore human population movements within the region. Socially, there's a lot of informal adoptions which have an impact on how registration is conducted. There are issues to do with name changes that are very rampant in the region. We have largely rural populations, and then we have education, which is a critical social service that the members of the population seek to access. Economically, we also cannot ignore that we work in a region with low-income populations. We have fishing as a major economic activity, being that we are surrounded by the sea, and how this influences, and particularly this in the context of how it influences the stakeholders that we call to be CRVS stakeholders. In many cases, we talk about health, we talk about statistics, we talk about education, but the fisheries departments in our region come strongly as key stakeholders in this process, because most of the lifeline of the Pacific people is around the sea and the water largely. Environmentally, we cannot ignore weather disasters and how this impact on the accessibility of registration services to the population. Next, please. So this is the region in which I work. We work with around 24 Pacific islands, and these are distributed in the way that you see them. Some of them are very small that you cannot even see. as you can see, we are surrounded by the sea. Most of these are a group of islands. So, and I will show you this in the following slides. You'll have a country like Fiji that has a main island, but also surrounded by multiple islands. So we have to think about how these populations are placed within this region and ensuring that registration services facilitate the context within which our populations live. Next. So in terms of contextual factors that influence system design, population mobility is a key issue for us in our region. On this table, I have outlined a few Pacific Island countries with their population sizes. You will see, I will give you an example. Okay, on the first column, I have the population sizes of each of these countries. I have the number of the people in these countries that live in New Zealand, the number that live in Australia, and the number that have died in New Zealand. Now, why I need to talk about this is that, probably, let me first go through the table. If you look at a country like Samoa, as at 2013, the average population was 187,000 people. Of that population, 50,000 were living in New Zealand. 19,000 were living in Australia. In that particular year, 430 died in New Zealand. Now look at a country like Norway. Norway has 1,600 people as of 2013. Of that population, 4,000 were living in New Zealand. Again, we had 700 of those in Australia. And you can look at the rest of the countries for your understanding. But what happens here is that people move a lot within these islands. And what happens is that if someone from Samoa moves to New Zealand and dies there, the registrar in Samoa never gets to know that someone died. So they continue to maintain a record of people within their country that are no longer existent. The other thing that happens very rampantly is name changes. So people move across islands, they go and change their names, and so their identities completely change, which is a risk to the validity of our systems. So in terms of our region, when we talk about human-centered designs, we cannot fail to recognize the fact that people are moving, and to make our systems recognize that we need to share information within and between registrars in the region. So what is happening is that we have a civil registrars network in the Pacific, and part of the dialogue is to ensure that they can share information, especially on deaths. So the Registrar of New Zealand would share with, let's say, the government of Samoa, these are the number of people that died within my country from your country. And that way, both systems are updated, and the same case with name changes. So data sharing is becoming an increasing priority in the region, and we are moving towards that direction. Next, please. Contextual factors, again, I had talked about having most of those countries being a group of islands. So we have very small populations that are spread very thinly over multiple islands. If you look at a country like Fiji, we have 106 inhabited islands. That is out of only 800,000 people. Again, look at Solomon Islands with 600,000 people, with 347 inhabited islands. So the question is, how do you facilitate registration services over such a small population that is so widely distributed? You cannot install registration infrastructure in each of these islands. So the issue around this is ensuring that we can depend on infrastructure within other ministries of government. It is necessary actually for us to ensure that we are using existing infrastructure within other government departments to facilitate registration. And one of those is education. We will all know that there's such a large uptake of education within these islands. And so schools are increasingly being used as a point to get to and to facilitate registration services. The example I've provided here is of Vanuatu. where they are linking civil registration services to education, and where the registration responsibilities have been delegated to the Ministry of Education, so that the parents can complete a registration form in the school, and that is sent to the education office, and a birth certificate is brought back. Of course, this is done in collaboration with the Ministry of Education. 2 minutes?
3 minutes.
3 minutes. All right. There's also a lot of cross-sectoral collaboration with health personnel in Kiribati, in Tokelau, in Nauru, and quite a number of islands. And with this, I would add there's also a lot of effort to increase demand for registration documents. For instance, we had the 2007 Pacific Mini Games hosted in Vanuatu in 2017, which brought in all the islands to participate, and in those they required that children provide birth certificates as a proof of identity and age. Please, next. And then again, economically, we also have to recognize that a majority of these populations live below the poverty line. And so we have to emphasize incentives that are incentives for registration rather than penalties, and also move towards policies that encourage free registration. And also, where possible, linking registration to monetary incentives has proven to be a big way to improve the response by the public. And here I have some of the countries, like Niue has an infant grant that is given to mothers and that is linked back to birth registration. We also have the Cook Islands and Nauru that have adopted some social welfare programs that are linked to birth registration. These countries listed here have free birth notification, but just a few have moved to providing free certificates of birth. Last slide, please. So in terms of the contextual factors, I think I want to end on the environmental factors, which are a key thing in our region. We are increasingly at a risk of disasters, and in particular cyclones. It's just this month, actually, one of our islands, Tonga, was struck by a big cyclone. So this is becoming an issue for us. And while designing our systems, we cannot keep from thinking about how do we survive in the context of these disasters. And if I was to share with you just these two case studies, one was Cyclone Winston that happened in Fiji, which left a number of registration offices without power for almost 9 months. You can imagine that you really need to know how you will function, because this is an incident that happens once, but will almost happen again and again and again. We have also in Vanuatu Cyclone Pam that struck in 2013, I think, and we had birth certificates destroyed, of course. And so these scenarios are creating an increasing need for conversation around how do we prepare for them in the civil registration context. We need to have off-site record backup. We need certificates that are waterproof. We need resilient civil registration infrastructure, ensuring that our registration offices are constructed on higher grounds, and that we can operate without electricity. And then we need to have disaster management plans for civil registration, etc. Next slide, please. So, in conclusion, I think the point that I would want to emphasize here is that we have to design systems that respond to where people live and how they behave. That is when we achieve human-centric designs. Thank you.
Thank you very much. Very nice, Gloria. Thank you. And
Give me the clicker.
when you actually talk about leaving no one behind, and in civil registration, you're talking about leaving no one behind and actually leaving no country behind, because that's very important. When we say no one leave, because you have to think about how do you provide service to people in such regions, and in situations where people are moving and someone going to another country and dying, and then how to keep track of all that. So I think you have presented in 3 contextual factors, try to explain what and why, and in terms of economic factor, environment factor, and what was the first one? Demographic factor, the important factor. So thank you for this presentation, and let's move to Bangladesh. Mukut, Ashfaqul Amin Mukut. He is the Deputy Secretary of the Cabinet Division, Government of Bangladesh. He has been working with the CRVS Secretariat, which is housed in the Cabinet Division, since its establishment in 2015. So they have a CRVS Secretariat in the Cabinet Division. He actually led and he is the advocate of CRVS and beyond. They are talking about CRVS or CRVS Plus model in Bangladesh. He works as a deputy project director of a technical assistance project being supported by Bloomberg Data Health Initiative, under which the Kaliganj model for birth registration and death registration for recording cause of death has been successfully piloted. I also visited the Kaliganj recently, last month, and looked at the human-centric model. He is a sought-after resource person, has conducted training and presented keynote papers in social protection and SDG issues. So he has a master's degree in political science from Dhaka University and business administration from North-South University. So over to you, Mukut, for your presentation on putting people at the core, CRVS and beyond, CRVS Plus.
Thank you. Let's now talk about millions. Forget about hundreds and thousands. Okay. In Bangladesh, we have 160 million people, and it is the most densely populated country in the world. And Bangladesh's capital, Dhaka, is probably the most densely populated city in the world. So everywhere is human being. So everywhere you will just you work through and you get stuck with another people. So it's there. So we have to think every time putting people at the core. Whatever we design, we think putting people at the core. And in our country, we took CRVS as an opportunity to go beyond just CRVS. We thought let's create a basic CRVS, and let's create something, a platform to provide services to the government, to the citizens. And so CRVS is a platform for us. It's an opportunity for us to create new services, new service design for the whole population of the country. It's not working. Yeah, So yeah, I'll not go into that because my previous two presenters has actually talked about the human-centered design and all those stuff. So I'm just skipping it. Could you please? You have to click a lot of things. And we are actually following this process map. So we are idea generation and we are testing and all those stuff, and also trying to come up with new design and also then going on. So it's a ever evolving design we are talking about. We are not saying that we have a design. We are actually trying to find out the design. Okay. So what I will do is that I will just discuss about the 7 features of this our CRVS and beyond design. The first one is identifying everyone uniquely. So in our country, could you please? We have lots of identification systems. We have lots of numbering systems. Trust me, you will be amazed. So so that's a challenge. Everywhere, every person can have different names and different spellings and all those stuff. So none of the systems are actually interlinked with each other, and we have all the complexities of the world. So next. So what we want to do is we want to create a one source of truth where we want to converge all the ID systems and with biometric identification so that we can actually uniquely identify each and person of the country. And then we have introduced the unique ID system in our country. It's a 10-digit number, a unique ID system. So that is what we are trying to do. So we are trying to converge all the ID systems we have already shown, since time is not that much. So we are trying to converge these systems into one unique ID systems. So idea is that no matter whether it's a birth registration system, whether it's an exam system, education, whether it's a national ID, passport, or health system, everyone may have their own ID systems, but own numbering system, whatever, but the person himself or herself will be identified by that unique ID, 1080. So that's it. So every birth certificate, you will have a BRN number, birth registration number, but the person will be identified by that unique ID. So the same ID will be from his birth to death, everywhere. Every services will be identified by him. So the person is being identified everywhere through the government systems. So that's the design we are having. Next, please. So we have already started it. The national ID system we have previously it was a 17-digit ID systems where the first 4 number were his year of birth and all those stuffs. But now it has moved to this 10 unique ID system. You can see. So hopefully the next to follow is our birth registration system. We are actually improving the existing birth. It's an online-based birth registration system, but it has its faults, and so we are improving it. And then we are also including the education system and the health system and also the marriage and divorce system. So everywhere it will be there. So we are also not only uniquely identifying the people, we are also actually making interoperable all the systems. We are also integrating the systems. Second one is the proactive services, quicker outputs. Please go on. So our current existing birth and death registration system actually is a reactive system. So when a birth happens or a death happens, you have to go there and say that a birth happened and please register me. So unless there is incentives, we do not do that. Like in our country, we actually, I always say that in our country, people are born, but people never dies in our country because we do not register deaths in our country. So it's and not registering deaths creates all sides of havoc. You understand. So and it's a quite complicated also. Next, please. Death is also, and during the death there is another huge complications in our country. Said if you are not registered, birth is not registered, you cannot register your death. So it happens. So all these complications are there. So what we have done is that, next please, we have created a proactive birth and death registration systems here instead of reactive. It's a model in our country which says that within 45 days of birth and death you have to register, but it doesn't happen here in country. So what we have done is that whenever birth and death occurs, we have actually included now in our country birth registration is done by the local government divisions. But what we have instilled is that we have now included the health facilities, health systems to do this help in birth and death registrations. Because health facilities and family planning assistants in the field, they actually visit all the, within their area of responsibility, they visit all the households within 1 month. So they know who is going to who is born, who is dead, all the stuff. So they are helping in the parents to fill up the forms and registering. So this is where it's a proactive. So no longer the parents has to go to the register. The health system are helping them to register these births and deaths. So it has improved. You can see in Kaliganj where this model is being helped, and Vital Strategy is actually helping us in this regard. So you can see in 2016 it was just 6 something within 45 days, but you can see that increase in 2017. So it's increasing. So it's a proactive and quick service output is there. Next, please. And again, death registration. Interestingly, as I said, we do not register deaths, but now death registration is being done because, again, I will come back. We have actually attached this death registration with cause of death system. So we are actually integrating a lot of things. So, next, please. The third one is the integrated process and databases. Yes, we need to actually not just proactivity. We also need the systems to be integrated and databases also should be integrated, please. So this our first scenario is that when a human is born, the health facilities should help notifying the health, and the registers who are the local government divisions should register, recognize this notification and register it, and the national ID systems which actually being managed by our election commission, they should acknowledge this birth registration and give the UID system. So from the birth, the UID system will coming on. So same thing, next please. Same thing will happen when a human dies. So his relatives will do the same thing. So health and family planning health workers will do the same thing. Could you please go? Thank you. That's a Kaliganj model we're talking about, where you can see this. Sorry?
You have to speak a little slowly because there's translation.
Oh, okay. Sorry. I said too much time.
No. You still have 5 minutes. Sir.
Okay. So in the Kaliganj model, what we, as I said, that now we have a proactive system where these health and family planning workers are assisting the families and parents to do their birth registration and death registrations. And we are also integrated this system with the expanded program on immunization, the vaccination. In our country, vaccination for children within 45 days is 100%. So we have included this birth registration system with this immunization system. So whenever they immunize the child, they know all this information of the child. So they are helping it with them. So this is an enterprise architecture of the birth registration system, where you can see 4 different agencies of the government. 4 different agencies of the government working on for one birth registration system process. So please go on. So similar the death registration system. I'm not just going to discuss it elaborately. Next, please. So what we are doing is now, so we are improving our current birth and death registration systems, and our marriage and divorce registration system is not a digitized system. It's a paper-based manual system. So we are also digitizing it, and we are introducing the cause of death. Earlier, we didn't have any cause of death system in our country. Everybody dies from cardiorespiratory failure, it says, the doctor says. So what we have done is that to make these systems and databases integrated, we have provided CCDS, meaning Citizen Score Data Structure. It means that whoever is designing a citizen database should be following this design, so that we can share data and make those systems interoperable. Next. Yes, this inclusive all-at-once design. Next, please. So it means that we have seen that in many of the countries, only when they talk about CRVS, they are talking about birth, death, and cause of death. But in our case, we are working with all of them. Not birth, death, and cause of death. We are working also marriage, divorce, and also adoption. And also, please, next. We have added migration and enrollment in the education system with our CRVS. That's CRVS and beyond. So 6 CRVS standard thing, and then migration and enrollment. And we want to use this platform, this unique ID system and integrated system, to provide service delivery, to improve the service delivery of the government system. Next, please. So in this way, what we are doing is that we are actually creating a dynamic population register of the country. Could you please go on? So if you see, so what we are doing is that we are using the birth and death registration system, we are using the NID system, and then using the education system in our country, or also health records. So all these 4 systems will be coming up with all citizens. Plus we are, as I said, that we are using adding the migration in. So whoever coming from outside the country are also in the system, and then we have always a dynamic CRVS database and population register in our country. So next, please. So next one is the integrated service delivery platform. So next. So it means, remember I said that we want to link this CRVS platform to improve our service delivery system. So what we have done is that we have also created, we have designed a integrated service delivery platform, another system where we want to, next please. We want to solve all these issues. No identity. No identity means in our country, birth registration happens only when they get the age of 5, when they want to enrollment in the primary education. But before that, birth registration is only 3%. So almost for 5 years, 1.5 crore people. So 15 million people are invisible in the system. They are not nowhere in our country. So we want to solve these issues, and then we have our multiple identities also. We have several birth registration. A person can have multiple birth registration simultaneously. We jokingly say that you can have your death registration in your country, trust me, within your pocket and walk around, so without being zombies. So and we have delayed registration. We have paper-based databases like the marriage and divorce system. So it costs actually too much to get the services. This high TCV all this. Sorry. Yeah, and then unconnected databases, and we have little actionable evidences for these policies. So what we did is that, as I said, this integrated service delivery platform. So we are integrating all the existing systems with this ISDP, so that everybody can talk with each other. So that's the design we have, and without this design, the systems would look like that one. So it will be extremely complex and unmanageable thing. So we have designed that ISDP system, and then we hope that through the CRVS plus ISDB, which we are talking about the CRVS and beyond, can actually provide all these services, not just birth and death registration, can provide all these services. Next one, the final one. So what we have done is that, as you can understand, it's a whole of government approach. It's not just one agency doing everything. So that's why, please next. That's why a steering committee and the CRVS secretariat has been established in the cabinet division in the government. So it's very unusual in the world where a cabinet division who are actually should deal with the cabinets, but we are doing this because in our country, cabinet division has the legal mandate to actually do the interministerial coordination and ask people and ask agencies what you have done, why you have not done something. So that's why the steering committee is there, headed by the cabinet secretary himself, and 17 other secretaries of different agencies and ministries are actually member of this steering committee of CRVS. So it's a huge, powerful and policy-making, decision-making, and then we have functional level committees also there, and then we have several thematic committees. Next, please. So that's it. I had a video, but there is something wrong with this sound system, so I cannot show that video. It's a 1-minute video that could show you the whole design at a glance. So, however, thank you. I was
You're right.
on time.
Thank you. Yeah, thank you, Mukut. Yeah, so we hear about the whole of government approach and how service delivery oriented approach that they are trying to follow now. They already have a model which is called the Kaliganj model. Basically, as we know that it's, when you have to reach out to the people for registration, it doesn't mean that you have to open registration centers in all places. You have to make use of the formal and informal networks as much as possible, because opening registration centers in far-flung areas does not make any economic sense and does not make any sense at all, because you cannot have a full-time registrar doing only registration of 5 events and 10 events in a year. So it is always better to reach out to other systems and other infrastructure that exists in the village. In Africa, the problem of registration, the infrastructure is that, if it is in the Ministry of Justice, the last point of registration at the district level is the Office of the Ministry of Justice, which doesn't go below the district level or province level. So it's always good to tap the other networks, the health network, the community network, which exists, informal networks like the community leaders, and try to reach out, at least in terms of getting information on the birth and death that occur at the community level. So now from that system, we move to a more sophisticated system, which is from Statistics Norway. And what Mukut is trying to dream about, I think he will find some solutions in Norway. And Vibeke will present that. Let me introduce Vibeke. Vibeke Nielsen is from the Statistics Norway. She worked with Statistics Norway for 11 years, 8 of which at the Division of Development Cooperation. The division's main task is to coordinate Statistics Norway to sister statistical agencies and systems around the world. As a part of the work, Vibeke has been involved in a variety of projects in Ethiopia, Kazakhstan, Kenya, Kyrgyzstan, Malawi, Uganda, and Zambia. She's also working on different technical and different topics, including civil registration and vital statistics. She is one of the authors of the Guidelines and Template for Developing Vital Statistics report, which is coming as a handy document in many countries who are producing vital statistics from civil registration, and also contributed to the current module of e-learning course on CRVS. So over to you, Vibeke, for your presentation on personal ID.
Thank you. So we had a discussion on what I should present, and we thought I could tell my own story. Is this working, or do I need help?
No, it's not working.
Okay.
Okay.
So if we can move to the next, thank you. I'm going to tell the story about myself in Norway as a start, and then we move more over to the kind of the general system that lies behind afterwards. So I was born, I was given a name and a birth certificate, and I was given a PIN code. In Norway, unfortunately, the PIN code still has our birth dates. It's a challenge because we are soon going to run out of numbers, because we only have 5 numbers which are not linked to the birth dates. So we recommend everyone to not do the same mistake as we did. But nevertheless, we still have this system. I have my PIN number, and this PIN number is following me everywhere. Next, please. One of the things where it's following me is when I need an ID. I needed an ID quite soon, since we were traveling abroad. And what my parents did is that they basically came with the birth certificate or with the PIN number, and everything was in the system. Because in Norway, government agencies are sharing information with each other. It's of course linked to legal legal system, but it's everything is kind of happening behind. So my parents went there, and a lot was already registered, so it was quite easy to get my passport. Next, please. And getting older, I needed different kind of government services. I needed vaccination. I needed information from, or I needed to be checked by the health system. It was the health system that contacted my parents for the different checks. So my parents didn't have to follow up on when we needed to go to the health care systems. This is also the case. Our doctors has a system where he can access using my PIN number to find information also if I visited other doctors at other parts of the health system. When I needed to go to school, it was again the school or the education system that contacted my parents to say that now it's time to go to school. This is the school you're going to. This is the information that you need and what you need to do. I grew up. I became grown up, and I needed to. I wanted to move to my own apartment. And I sent information of this to one government agency, and this government agency shared it with everyone else. So all of government knew quite quickly that I had moved. I also wanted to open a bank account, and again, I just needed to go to the bank, tell them my PIN number. Of course, I needed an ID as well, and the bank account was opened. And I want to add to this actually that when this system of kind of unique personal identifiers was established in the 1970s in Norway, the banks were actually one of the main drivers for this, because they wanted more security and they wanted more information available so that they had more safety around kind of giving loans, opening bank accounts, taking care of people's money. I also got a job, and I needed to pay taxes. Luckily for me, it's my employer who sends in a lot of information about me to the government. And it's the government that fills in my tax return and sends it to me, so I don't have to do anything. I only have to check it, of course. And this is also part of a kind of portal which we call Alt-in, which is translated everything in there, where we have different forms and different kind of exchange with the government online. And this is also where we access the tax return and where we verify it and check it. I actually also opened a business a few years ago. There again, my business got a unique identification number, and it's linked to me. So everything that happens with this business is linked to that PIN number. It's legally specified that all receipts in Norway have to have the PIN number of the company, so that it's easily verified and checked that the company is legally established, and you can also follow kind of the company's returns, the company's income, and so on. Then I fell in love. I found a man. And he, unfortunately, no, this is not true, but if he had been a foreigner, he would also have been registered in Norway if he had moved to Norway. If it was initially only for 6 months or less, he would get what we call a D number. He would not automatically become part of the population register, but he would become part of a system that is linked to it. So he would also have an ID number. Getting married to me, he would probably become permanent a citizen. So he would be part of the population register. Next, yeah, and next, please. So this is kind of my story. There are more parts in this which are going to come on later on with kind of new vital events happening, but I'm not going to go into that since I don't know what will happen to me yet. But what is behind? Ashfaqul talked about kind of the population register, and this is something we have in Norway, and you can call it an integrated population register, where you have all the vital events linked together in one system and linked to one PIN number. It's the births, it's the deaths, it's marriages, divorces, adoptions, and everything. But it's also the addresses. In the population register, we also have address, and you have to register again if you have to register that you move. In that way, we are also able to get an overview over migration within and into and out of the country, which is helpful when you actually are going to create statistics and when you need an overview of the population in your country. But it's also something which is useful in this that a lot is happening without us as the population knowing what is happening, and without having to share information with the government, is that there is a linkage between this address, which is also seen as a unique identifier, because we actually have a code for every apartment. It's not only a housing code for the whole building, but it's for every single apartment. So this can be linked to the housing register, but it can also be linked to the business register. So the address is actually a joint identifier for what we call the 3 core registers in Norway. And there's exchange of information between these registers and also other key registers in Norway. So a lot of information is exchanged without us knowing or without us being aware. Next, please. The other part of it is within the population register, I am here, and then I'm also linked with my parents. So when I enter the population register system in Norway, I would also be able to find the PIN number of my 2 parents. I would be able to find the PIN number of my spouse and cover information about the spouse. And if I had children, I would also be getting that linkage. And it's all in one system. So it's also improving kind of the overview for the government, and it's making it easier for me also to prove that I'm married to someone and that I'm the parent of someone. So for statistics, coming from Statistics Norway, I of course want to focus on this part as well, since we are also part of this whole government system where information is shared. We are also getting all this information from the register owners, from the population register, from the address or housing register, and from the business register, and from other registers. And based on that, we can produce detailed statistics, but we are again also focusing on trying to make the statistics and the data that we make interesting and available for the population. So, for instance, we have now in the last years been quite active on Facebook, trying to make quite simple infographics about kind of how the population is put together, what the core elements are, trying to make it interesting for a broad audience. Also, of course, keeping the detailed information that other parts of the audience would need. So, just checking here. Yeah. We are only able to make this detailed information because we have access to this. And it's, of course, for us, it's much easier to produce the statistics because we get this information easily, but it's also reducing the burden on the population because we don't have to go out and carry out censuses. We don't have to carry out as much surveys as many other countries have to. So it's also kind of making it more human-centered because it's less of a burden, less of a time spent on reporting to the government because we are able to get this information from other government sources. It's already been collected. Then we often get the question, is this a secure system? How about kind of the confidentiality and all these elements? And of course, there's always a risk. You can't avoid that. But it's quite specified legally what can be shared, who has access to what, and it's not shared with everyone. There is information which is open to everyone, of course, name, address, and so on. It's not secret, but there are other elements which are more difficult to share. And you need to prove that you actually need the information to be able to get access to a copy of these data. And we also have a quite strong data protection authority in Norway, which is following this very closely and which is interfering if they see that there are some challenges with what is going on. Yeah, next, please. So just to summarize, the key elements, the way I see it, is kind of having the unique identifier to make sure that we can actually share the information easily within the government to make it easier for the population, not having to run many different places, not having to register many different places. It's the integration and linkage. The civil registration and the ID management is one system, but it's also the sharing of the information. I talked about the core registers, but it's also kind of giving access to those that need it. The police, for instance, health institutions, education institutions, and so on. Report once and use several times. What do we do in Norway with all the spare time? We go skiing. Thank you.
Thank you. So, you don't realize that identity is so important when it really comes to situations where you're trying hard to prove your identity. And I remember having worked in India in the civil registration office, I often, at least one time, I received a letter from someone who was declared dead by her son. And she was claiming that she was alive. And she's that person. And the son was trying to prove that she is not her mother, his mother. And this went on for a long time because she had no means to prove that she is she. And therefore, at times of distress and times of difficulty, you really have to have an identity. And it actually one politician was supporting the son, the other politician was writing in favor of the mother. So we had to finally give it to the police to verify and finally come to some kind of a conclusion. But look at the situation where the mother is, and she was like 70 years, illiterate, and trying to prove an identity. So you don't realize when you are in a world where you have identity, you take it for granted. But in a country where identities can be very, very important. And every time a person has to take a service, he or she has to prove identity again and again. You go for service, you bring an identity. You go to another service, you bring an identity. It's not linked. It's not interoperable. So I think these systems have to be developed. But we have to take care. These privacy issues are now coming up in a big way. Who manages the address? Should the address should be in the database? Or is it the location that it should be in the database? And if you order for pizza, the pizza maker will tell you that you're not supposed to take pizza because you have health problem and all that. So I think there is a limit to what we can do, but I think identity is important, and the centrality of CR and its linkage with national ID are very, very important. We often don't recognize that. I'm worried, like in India now, they are saying that you don't have to use birth certificate to prove your date of birth. Aadhaar number would be enough to prove your date of birth, which is a very risky proposition. But anyway, so I'll stop here. I don't want to, I've spoken enough. I think we have, I managed to get half an hour out of this session because question and answers are very, very important. So let's have a session. I see hands and I will recognize. Oh my goodness, so it was rude. So what I did was I scanned on the left, so Annika raised her hand first, and then you, then Irina, then Philip, and then ed. So, Annika, go first.
It always helps to sit close to the chair, doesn't it? Good morning, everyone. My name's Annika Schneider, for those of you who don't know me, and I work for Canada IDRC and helping to support this really great conference. I'm not even being biased when I say that. So I have two questions, but just to say, firstly, and for those of us who've been around CRVS for a while, so lovely to see the sense of progress with some of the country examples that are going on here, some of the numbers, even though. So what I loved about this was not only about human-centred design, but it was about testing new things, it was about trialling, it was about, checking a district, it was lots of things, reflections on the amount of water in the Pacific. Because I'm taking notes as we go through this for the conference report, I just wanted to check in with a couple of concepts that came up. Firstly, I think it was Bangladesh, you mentioned an iterative process, right? This is not just one process of improvement, it's adaptive, it changes, you're testing, you're trying to work out. So how important is that? I mean, that's probably a leading question. How important is that to the ongoing improvement of CRVS systems? And probably linked a little bit with that is the example with Norway of your longitudinal system, effectively. So you have a longitudinal system collecting information for people across the course of their life. And to what extent is that longitudinal information then ploughed back into how that system can be better designed?
I'll take three questions at a time and then ask the panelists to respond. So, your question, madam. Can you introduce yourself for the other?
Hello, thank you. My name is Jacqueline Barber, and I am a human rights lawyer based at Harvard University. So this was a really fascinating panel. Thank you. I learned so much. And I have tons of questions, but I'm going to limit myself just to really two. The first is there's always, as we know, a trade-off between transparency and efficiency and the government kind of contacting you rather than you contacting the government, and the danger of excessive transparency to government as a source of authority. And with increasingly authoritarian systems developing in many very large countries, I wonder whether any of you think this is a source of concern. But even in the Norway context, what about people who've had criminal records? What about undocumented migrants? I'm very involved at the moment with the question of unaccompanied Afghan youth. How do they interface with a system where it's very difficult probably to do anything unless you have a PIN number that kind of makes you readable? And related to that, I guess, and reflecting on my experience, a lot of which is in India, it's fine to have a unique identifier that becomes increasingly necessary and therefore increasingly a kind of way of integrating diverse systems. But you need to have a comparably efficient, consistent, reliable infrastructure to access information. So we heard from the colleague in the first plenary panel that even in Canada, internet isn't always available. Forget India or maybe, Bangladesh or Tanzania or the Pacific Islands. I mean, you cannot rely on a system delivering the information you need when you need it. And so the more you centralize and the more you mechanize information retrieval, the more you're putting some of the most vulnerable populations at risk. And so I wonder whether this kind of efficient techno system is actually going to create whole new waves of excluded populations, and far from making benefits more portable, it's actually going to make benefits maybe less portable for vulnerable populations.
Yeah, Irina.
Yes, hi everyone. My name is Irina Dinko and I'm a senior program specialist with the Center of Excellence here in Ottawa. I would like to thank you all. I think you have given really an overview and about the challenges and also the progress which could be made into the future, and we hope that the future is going to be really near. I have more a comment than a question, and maybe a question at the end, and it's directed to my colleague from Tanzania, but I think that it is valid for us all. I'm a bit uncomfortable with this term awareness. And I'm uncomfortable with the term awareness because it doesn't really help us much. And if there is anything we learn from public health, and I'm really thinking about polio eradication program, is only when we moved to social and behavior change that we have reached really the last inch. I mean, we eliminated almost polio. So my comment is, how do you move from awareness to behavior change? How do you partner actually with communities to increase demand for registration? Birth registration is very high, and even if it's at 28%, death registration is very low. So what are the levies in the communities, and how do you partner with them better even in the design of the systems to increase death registration? In other words, how do you move from knowledge to practice? Thank you. Okay, so can we take 2 questions? Then we have one lot finished here. So, Philip, you.
Yeah, thanks. Philip Settle with Vital Strategies. I direct the Bloomberg Philanthropies Data for Health initiative. I'm following on directly from Irina's question, which is that it seems that in terms of demand creation, a lot of it has to do with actually removing barriers, which isn't quite the same, but it gets us down the road to at least making sure there are no obstacles. But I have a similar question to Irina. Are there ways that you have experienced in your country-level work for the whole panel of creating incentives somehow, particularly for death registration, but also for birth registration, that aren't of a sort of punitive nature, the way that Raj articulated at the beginning, where if you don't have a birth certificate, you're somehow denied the right to an education? Are there creative solutions bubbling up from the grassroots? Are there clever people in your country situations who have ideas about actually stimulating demand? Thank you.
Ed.
That's it.
Yeah, no, I was...
Oh, we keep going.
Ed. I thought you said end.
No.
Ed.
Ed.
That's ended. I am Ed. Hi, everybody. My name is Edward Duffus. I'm the head of innovation at Plan International. So I feel at home with this conference. It's wonderful. A couple of comments, really, about human-centered design. It's something that we are embracing in the work which we're doing on innovations, and it makes sense because innovations are often about solving problems or responding to a need. Well, the need of who? It's the need of people, mostly, particularly for children in our case for Plan International. So we delve very deeply into this area of understanding who these humans that we're centering design around actually are. And in fact, I would encourage, it was fantastic to hear in the presentations, we're embracing this idea of human-centered design and really thinking about design and the drivers. But we can go beyond that. We can, because human-centered design at its core is about empathy for people. And so when one might see a presentation on human-centered design, I would see a lot of people. I saw quite a lot of systems and processes. It's really about people. And so building up personas of people, what their real needs are, what makes them happy, what makes them frustrated, etc. That when we go really into the depth of it, that's what human-centered design is all about, and designing for these people. Just to expand on Raj's point, because certainly I wouldn't want to see there's a discrepancy between human-centered design and the use of technology. The two go hand in hand. I think there's some great examples of that. Maybe a good way of thinking about that is if you think about digital experiences that we all love, because they're all designed from a human-centered design approach. So, for example, the thing you might get out on your phone and have a look at your app, like when we use Uber all the time, but potentially we use Airbnb. These are solutions which, I think they kind of delight us. They're really easy. You click through them in just a few clicks, etc. They're designed absolutely with the human very much at the center, and not only from the original design principles, but also through prototyping and observing the behavior of humans actually using those solutions. And in fact, it's going on every single day. Okay, that's a very developed world situation where, for example, applications, and I mentioned them again, like Uber, for example, they are modifying and changing that application as we sit here, and we are effectively testing those applications in real time as we use them, and they're beta testing and testing as they go. So it's continuous improvement through observing the behaviors of people. We could maybe embrace some of this thinking in what we do. Finally, and just as a bit of a plug for human-centered design, in the innovation lab tomorrow that I'll be running on open systems and digital CRVS as a global good, we'll in fact be doing a co-creation session using human-centered design. So if you want to come along and see what that looks like with real user personas, then please do. Thanks.
So I'll come back to you. So let the panel address these questions. So Vibeke, you can go first. I think there was this question from Annika, partly you have to address, and Jacqueline's question on, the transparency part and also the exclusionary nature of this thing, particularly people who are not enrolled. And I think these are the questions for you, and then we can move to.
Thank you. I'll start with the second part first. The unregistered, of course, it's a challenge, but it's also something that is worked on. And there are health centers, for instance, for those that are kind of not registered in the country. There are a few systems and elements in place for those that are not registered. We are probably lucky in Norway in that sense that we even though they're not registered, we have a quite good awareness of where they are and what their needs are, so that we are able to follow up with them even if they're not registered. But also for everyone coming to the country initially, they are getting a number, as I was saying, a D number before it's clear whether they will stay. So every asylum seeker will get a number even though he doesn't get the PIN number right away. When it comes to the transparency, of course, I agree that it could be a risk many places, and it could also be a risk in Norway. But so far it has been working quite well, and I think the population is also surveying it quite well, in the sense that they are providing feedback and that there are discussions in the country if something comes up which is not really working the way it should. And then to the longitudinal system, could you try and explain a little bit more what you were asking?
So it's not just births. Oh, sorry. It's not just births and deaths recorded in your system, but you have your immunisation record and all of those other things. So to the extent to which that other data, along with the vital statistics, is used to improve the system as it goes forward, if you know.
I think we've had the integrated system for quite some time, but it's if you talk about quality of data, one of the things that we have been doing quite a lot in the last years, especially at Statistics Norway, is to provide input on the quality of all the records of the different systems, where we actually do linkage between the different systems to check if it's the same everywhere. And we have found challenges where we report back, not on individual level, because we're not allowed to as a statistics office because of confidentiality, but on general level, saying here are a few elements which we see that there are some persons married on one side but they're not on the other side. Please go in and check that everything is working the way it should. There's also use of forums of the different registers where they can exchange information and where challenges are discussed, also to improve the systems and to continue working on the systems. So there are a lot of both user forums and also working groups to improve the systems further and to move towards more integrated systems and also more electronic systems. Did that respond to the question? Yeah.
Yeah. You have to, I think you have a question. I would suggest that this issue of internet connection, because if you're building a system so big and this whole thing about the system being exclusionary rather than inclusive is a risk. So because people who interact with the system would be they may find it difficult to interact with the system and then may be excluded from certain services. So if you're building a system like that, how do you think you will address this? Because their system is more sophisticated. Because this is a risk that you have to take into account.
Yeah. Thank you. Yes, that's a risk, and that's definitely we need to actually be very careful of what technology we use and this kind of thing. But what we are now rightly focusing right now is that we are trying to change culture actually, where people do not register their deaths. So we're trying to change that culture. Do register the death because it's important. So what we are doing too is that instead of asking them to do their registration, we are actually going from the service provider actually going to do their registration and showing all the stuff. So, but as I said, in technology, what we have seen that like in our country, if you go to the statistics, you see that Bangladesh has one of the most highly mobile phone penetration rate in the world. So it means that if the technology is people-oriented, as I said, human-centered, it's really helpful. People actually can adopt that technology. So we are also going to the answer to her question that we are not saying that this is the final product we are going to say. So we are actually testing a lot of design, lot of processes as well. So trying to find out the ultimate solution maybe. But again, it is also dynamic because with the change of time, everything will be shifting. So we are not sure, but we're trying to find out a optimum solution to all these issues they are saying. But we are definitely careful about this issue, definitely.
So can you reply by citing India? Go ahead. In India, as you know, Aadhaar has been linked with the public distribution system. And in 2017, there were 32 deaths because the families, they did not get supplies because the authentication could not happen. So now states are going back to the old system. So there is a big risk. And if you go to the northeastern part of India, if you go to central India, connectivity still is a big concern. So if you try to link Aadhaar with everything without addressing these issues, that will create a chaos.
Yeah.
Sorry. That's why we, in our country, we have not tried to come up with a new idea and saying that everyone is discarded, like India did with Aadhaar. But what we are doing that we are saying that we are not disturbing anyone. Everyone is doing their work the way they are working right now. But we are trying to, from behind, creating this integrated platform so that nobody get disturbed. So that's the one.
No, thank you. The whole issue is that anything you do has to be persuasive in nature and not, the problem with the government's functioning, having worked in the government, if you issue an order saying that the birth registration has to be linked with the education, you ask for a certificate, they will not register children in school because the government has said that the government sometimes doesn't say it in that many words. They just say you need to have it. That doesn't mean that you don't provide service to a person who is coming. So even for food, if the person has come to ask for food and ration, you don't say that you put your fingerprint and then get your ration. That's not the way it has to be designed. So anyway, so there are because there is a question waiting and I have only 9 minutes.
It shouldn't be like that, but we all know how these things work in practice. At the moment you have a kind of, a general rule about what counts as authentication, every small level administrator is going to insist on it. And and the pie inequalities being what they are, it's very difficult to reverse. So I imagine that 37 or 39 is probably a gross underestimate of how many deaths there have been because of Aadhaar, actually. So I think even in the Bangladesh system where it's great to integrate, but I'm just wondering how you protect yourself against this sort of mission creep that it then becomes compulsory.
Yeah. Okay, so thank you. So there is a question on moving from awareness to behavior change, and that's for Bhaskar, and creating incentives. That came from Phillips. I think if you can share the question. So which one will you take? Awareness to social? Okay, you take that, and then if you can say a few words on how to create demands.
Like in Tanzania and other African countries, how do you expect a decent level of awareness when registration was not compulsory? For example, in Tanzania, registration was not compulsory for the natives until 2009. There have been a few diagnostic studies, and you'll be surprised with the findings. Less than 30% of population are aware about RITA, the Registration Insolvency Trusteeship Agency. Forget about the detailed CR process. One thing that is going to improve this is by linking the utility of certificates with other services. And government of Tanzania has started acting in this regard. Now, recently they have linked birth certificate for availing education loans, for appearing in Form 4 examination. Of course, like if you want to have passports, you need to have a birth certificate. Slowly and gradually, government of Tanzania has started doing it, but there has to be a balance. You should not make it mandatory without having the issues sorted out from the supply side.
Yeah, true. No, but the question, the question of social change, behavioral change. I think that question still remains. Anyway, you have anything to add?
No, I was just wanting to say that even when the system exists, I've just give you the example of Guinea, right? It's 78% birth registration, 1.3 is death registration. Why is that not following the birth registration if the system is there? And similar is the case in Cameroon, and the director was saying even this morning. And I think, Raj, you can give an example of another 50 countries where is the situation is the same. So the question was really about behavior change, mostly.
Yeah, go ahead. So,
Sorry. I think a big part of it is about embedding civil registration as a service within another service. I think getting to understand what do people really want, what are people looking for, and having birth and death registration services embedded within that. I think that is how we would make way with this issue, because for as long as we continue maintaining it as an independent service, then there will be a lot of it. We will go through a lot of push to get someone to really come to the counter and request for that. I think New Zealand has developed a system where mothers who are pregnant log into a website. They have a website that they call Smart Start, where you go in there while you're still pregnant, and it has a basket of other services that you're looking into, and then within that, birth registration pops up as one of the services that will help you get into another service. And I think that will be a good approach into how we design systems and ensuring we don't stick on our own lane, but embedding these services within what people are looking for.
Yeah, thank you. I don't know whether I have time. We have 4 minutes, right? Yeah. So quick question, which will be followed by quick question to be followed by quick answer. We have 3 minutes left.
Okay, thank you. My name is Leah Mwai. I'm from IDRC, from the Maternal and Child Health Program. I just had a quick follow-up, some of the points that were raised about the exclusion and the increased visibility that is presented by civil CRVS systems. And I just wanted to ask, and I think one of the comments that was made as well to the fact that a lot of these are the requirements of government other than individuals. And I wanted to just, based on my own experience of, as a consumer, but also talking to a lot of people in several jurisdictions where you have to register, is a question about because I think that the view is that a lot of these processes are very linked to the political in many countries. So there's a lot of pushback that is just about the political, because some people maybe being registered or counted as a community or as an individual sometimes will have a lot of implications in those jurisdictions to the political. So I just wanted to understand from the human-centered perspective, how are you approaching that to make sure that you're engaging with the political, or is that even important?
Sorry, I think maybe you have to talk to her separately because I have been given a signal of 2 minutes, and which is now reduced to 1.5 minutes. So as I speak, so thank you. I think we can talk separately on this. So thank you very much. It was a wide, diverse range of presentations from Africa to Pacific to Europe to Asia, and coming out with different aspects of human-centered design and addressing the core aspects of those designs that we are talking about. So thank you very much. Let's applaud the speakers. Thank you so much.